Good afternoon, Goodwin House at Home members, Goodwin House Priority Club members, and friends. We will now begin today's webinar. This webinar is being recorded so those not able to join us today can listen to this program at a time that is convenient for them. A link to the recording, the PowerPoint slides, and a written version of the Q&A and our featured experts will be included in an email to all attendees to be sent next week. My name is Katie Ramos, and I am the Program Associate for Goodwin House at Home. It is my pleasure to introduce your program moderator, Lindsay Hutter, the Chief Strategy and Marketing Officer for Goodwin House Incorporated.
Thank you so much, Katie, and welcome everyone. We are delighted that you're taking time to join us today and gain insights on the pandemic's impact on long-term care affordability and accessibility. I want to share with you that these topics are very personal to all of us in the Goodwin House family, whether we have grandparents, aunts, or uncles, or in my own case, my own mother, who is a resident of Goodwin House, Alexandria. These are all very personal topics for us. This is actually a photo of my mother. She was 94 and a half when she moved to Virginia from Illinois. And that's my brother and me as we were flying from the Midwest to bring her to Goodwin House, Alexandria, where she's now a resident. So as I said, for all of us, these topics on how to keep older adults financially, mentally, emotionally, physically, and socially safe is very personal to all of us. So let me now share a little bit about Goodwin House Incorporated. We are a senior living and healthcare services organization, and we serve older adults all throughout Northern Virginia. What you're seeing on this slide shows you that with Goodwin House, you can choose to age in place in your home for as long as you wish. You could choose to move into one of our life plan communities, or you can do both. We have many Goodwin House at Home members who started off aging in place in their home and then decided they wanted to move into a community, and we were glad to welcome them. So at Goodwin House, you have options on where you want to live and safely. Goodwin House also is very focused on how older adults live. And over the last several years, in fact, last few decades, we have been focused on developing a variety of home and community-based services. And as you'll see on this next slide, when it pops up, there are 3 specific ways that we support older adults. We support them through Goodwin House Home Care. This is private duty home care where private duty aides come in and support with various activities of daily living. We also have Goodwin House Rehabilitation Services and Home Health. And this helps older adults that perhaps have had surgery, had some sort of acute health condition, and need various therapy and rehab services to recover. We also have Goodwin House Palliative Care and Hospice. Now, our home health and hospice services are available to older adults all across Northern Virginia, not simply in the Goodwin House Life Plan communities. All told, Goodwin House serves nearly 2,000 older adults every year across Northern Virginia. For 6 months, Goodwin House has been very focused on protecting those we serve and those who serve from COVID-19. As America enters month 6 of the coronavirus pandemic, we can take stock of what we have learned about the virus, how to protect ourselves from it, and how to treat people that test positive and experience intense and life-threatening symptoms. So as you'll see from the next slide, I want to give you just an overview of some of the webinars that we've done. 2 weeks ago, we hosted a webinar with one of our medical directors, Dr. Margaret Gloria, on the various learnings, on treatments, on vaccines, and on what we can expect in the fall and winter with the virus. At the end of this webinar, I will provide details on how you can access and view that webinar and others that Goodwin House has produced to help older adults protect their physical, mental, emotional, and social health during the pandemic. Today, we focus on another type of health, financial health. Our title for this morning's webinar is Financing Your Future, Expert Insights on How the Pandemic Affects the Accessibility and Affordability of Long-Term Care Coverage. So let's now shift to the agenda, and I will explain how we're going to cover this topic over the next 55 minutes. We've just done opening introductions. I'll have a few further remarks about Goodwin House's efforts to protect our residents and our members through the pandemic. And then it will be my pleasure to introduce our two featured speakers, Howard Gleckman and Tom West. Following presentations by Howard and Tom, we'll have a fireside chat. I guess I should have said a poolside chat. A fireside chat sounds just a little bit warm and uncomfortable given that it's in the high 90s today. But nonetheless, we're going to have a conversation with Tom and Howard. Well, I'll ask a few questions, but they'll also ask some questions of each other. And then we'll close out with a Q&A with the audience, and it will be your opportunity to ask questions. Now for a few webinar housekeeping notes. You'll see on this next PowerPoint slide that our featured speakers and their slides will be visible to you on your computer screen. You may want to adjust the volume on your computer if you're having trouble hearing me or Howard or Tom. You can also post questions through the chat function in the questions pane at any time during the webinar, and that pane should be on the right side of your computer screen. Following Howard and Tom's presentations in the fireside chat, we'll shift to your questions. Now, we've already received many questions from registrants, and we'll work through answering those as well as the questions that get submitted during the webinar. So this next slide is going to show you how to pose your question in the question pane. I'm going to give you just a minute to take a look at this and study it. All right, so be thinking of your questions and posing your questions as the webinar is taking place. Now, I want to take just a moment on this next slide to answer a lot of the questions that we've received about Goodwin House's approach to COVID-19. How many cases of COVID have we had in our communities or across our Goodwin House at Home members? There are 4 key points that I want to make. The first is our leadership focus. The second is the proactive approach that we've taken. The third is the prioritization of engagement with our residents and our Goodwin House at Home members. And finally, our mission mindset. Let me first comment on leadership focus. We established an infection precaution and planning team, and it began meeting March 2nd. This is a team that is comprised of key senior leaders, our clinical leaders, and our medical directors. This team meets daily to assess the COVID situation, new research, new practices and guidelines that we're receiving from health authorities, and input from our residents and members on how we can keep them healthy and safe. We've had a very proactive approach. We began implementing protocols for the health and safety of our residents, our members, and our staff in early March. And we've had an ongoing testing program of residents and staff that we launched in early May. We didn't have to do this. We chose to do this. And we test regularly for our staff and for our residents. In fact, both Goodwin House Alexandria and Goodwin House Bailey's Crossroads, all residential living residents are being tested today as a part of our proactive testing. Prioritized engagement. That's our way of saying we want to make sure that our residents remain as socially active as possible and as mentally active as possible and as healthy as possible. And so we've shifted to online delivery of programming. We set up a grocery order system and delivery for our Goodwin House at Home members so they could stay safely in their home during the peak in Northern Virginia. So we've really shifted to socially distant programming and virtual programming to keep everyone engaged. And finally, mission mindset. Goodwin House is a not-for-profit, mission-based senior living and healthcare services organization. And when it became very clear to us in early April that it would be difficult to obtain PPE, we simply weren't a large enough buyer to go in the global markets. We organized a group buy with 55 different organizations, some of them large hospital and healthcare systems, and literally invested in hundreds of thousands of various types of PPE. We were able to go on the global market with that group buy and make sure that 55 different organizations had the PPE they needed. We continue to share what we've learned and seek to work together with other organizations. We are in this together. We are in this together. So with that update on Goodwin House and how we've done, you probably wonder how many cases have we had? We've had one resident in residential living test positive at Goodwin House Alexandria. That resident has now been out of the COVID situation, tested negative, was asymptomatic throughout, and is doing fine. We had 7 residents at Goodwin House Bailey's Crossroads test positive. Early on, 2 of them with underlying health conditions were hospitalized, and very sadly, we lost them. The 5 other residents that tested positive have recovered and are all doing fine. We've had give or take, about 3 dozen staff members across both communities that have tested positive, and all have recovered. We have 3 waiting to return to work at Goodwin House Alexandria, and that's simply part of our back to work testing protocols. So we're very thankful that our staff is all well from COVID. Now, let's shift to the featured speakers. It's my pleasure to introduce Howard Gleckman. Howard is a senior fellow at the Urban Institute in Washington, D.C., where he is affiliated with both the Tax Policy Center and the Program on Retirement Policy. He is the author of the Urban Brookings Tax Policy Center's fiscal policy blog, Tax Box, and he's got a weekly blog on aging issues on Forbes.com. Prior to his think tank role, Howard was a senior correspondent in the Washington Bureau of Business Week, where he covered health and elder care, as well as tax and budget issues for nearly 20 years. Howard has dedicated himself to many healthcare and aging organizations. Among other community service roles, he is immediate past chair of the Board of Trustees of Suburban Hospital in Bethesda. He is a trustee of the Patient Safety and Quality Committee of Johns Hopkins Medicine and vice president of the Jewish Council for Aging for Greater Washington. Welcome, Howard.
Thank you so much. It's a real pleasure to be with you today to talk about what's a really, really important issue that I know is on a lot of people's minds. So my job today is to give you a little bit of background on long-term care, which is also sometimes known as long-term supports and services. It's an often terrifying, always confusing topic, and it's clouded in myth and misinformation. So let me take a few minutes to talk about the realities of long-term care in general, and then a little bit of time to discuss long-term care in the era of COVID-19. First, what do we mean by long-term care, which is sometimes called long-term supports and services? At low levels, this is assistance with activities such as transportation, cooking, and cleaning. At higher levels, it's to help with activities such as getting in and out of bed, eating, or bathing. Let me give you a few numbers to give you some sense of the magnitude of this issue in the United States. 2 out of every 3 people over age 65 will need some supports and services in old age. 2 out of every 3. And half will need a high enough amount of care that they'll trigger a long-term care insurance policy benefit or Medicaid benefits if they had them. In all, about 13 million adults receive long-term care in the US. And that's a number that's going to double in 20 years as the baby boomers age. A key issue here, remember, is when you reach age 80 is when you are most likely to begin to need this kind of care. Currently, of the 13 million adults who receive long-term care in the US, only about 4 million, or less than a third, are on Medicaid. The rest pay for care out of pocket or rely only on the care of their relatives. 60% of those getting this care are 65 and older, and the rest are younger people with disabilities. People who may have had an injury, may have had a disease such as multiple sclerosis, that sort of thing. It's also important to remember, while nursing homes are getting an enormous amount of attention these days, which is not a surprise given that so many people have died from COVID in long-term care facilities, it's important to remember that relatively few older adults live in long-term care facilities. The reality is that of the 13 million people who need care, only about 5%, or 700,000, live in nursing homes. Another 700,000 live in assisted living or in similar congregate care. The other 85 or 90% get care in their own homes. So long-term care is not a nursing home story. It's mostly a story of people who are aging in the homes where they've lived for many decades, or perhaps in an independent living facility. Nearly 85% of them get their care from family and friends, spouses, adult children, grandchildren, and neighbors. Only about 15% have paid aides. And it's important to remember that those aides are poorly paid. On average, they get only about $11 an hour. So if you hire an aide through an agency, you may pay the agency $22 or $23 an hour, but the aide will get only half of that. They also get no sick benefits, and most commonly no retirement benefits. They also have among the most highest injury rates of any occupation in the US. You're actually more likely to be injured if you're a home care aide than if you're a coal miner. Yet, despite the low pay that these aides receive, long-term care is incredibly expensive. A nursing home in the DC area costs an average of $125,000 and up. A good assisted living facility starts at $60,000 and rises with care needs. A full-time aide at home costs about the same. The average American has financial assets at age 65 roughly equal to the cost of 1 year in a nursing home. Fewer than 10% have long-term care insurance. And that means for many families, this is a disaster waiting to happen. So speaking of disasters, let's talk about COVID-19. The numbers are uncertain, but you've probably read this in the paper. Over 50,000 residents of long-term care facilities and staff have died from COVID-19 since last March. And we're beginning to understand what's happening. First, facilities with the highest number of cases and the most deaths tend to be in locations where COVID is widespread in the broader community. In other words, if a care facility is in a hotspot, it's likely to become a hotspot itself. We think that for the most part, the disease is being brought in by staff, since visitors have been banned for many months. So what's happening? We think that aides are catching the virus in the community, perhaps on the bus to work or from their families, or because so many moonlight at second or third jobs in another facility or from a private client. Because they have no sick leave, they may come to work even when they don't feel well. But because testing remains unavailable and slow in many places, and because the disease can be spread by people who have no symptoms, aides may inadvertently be bringing coronavirus into a facility. And then in facilities that have poor infection control, it spreads rapidly among a highly vulnerable population. What can facilities do to prevent these outbreaks? First thing is they need sufficient personal protective equipment for staff and residents. They need to practice strong infection control, and they need regular and rapid testing. They need to separate residents who have coronavirus from those who don't, and they should make a deal with their staff. We will pay you a bonus if you agree to work exclusively for us and not take on moonlighting jobs. So what can you do to protect yourself? Well, I'm not a doctor, so I'm not going to give you clinical advice, but let me give you two pieces of very general advice. One is plan, and one is communicate. And this is advice that's good even in the best of times, but it's especially important now. Now, Tom's going to talk to you about financial planning. I'll leave that to him. But you also need to plan for your care needs. Times like this, life is going to throw uncertainty at you. Can't anticipate every challenge, but you can be prepared. So let me just give you one example. What happens, let's say, if you're relying on an adult child to provide you with some support, maybe giving you rides to the grocery store, picking up food, picking up medications at the pharmacy, or just coming to visit? So what happens if that adult child gets COVID? Is there a backup plan? Have you really talked about what that plan is going to be? And that brings us to the second issue, which is talk, talk, talk. It is absolutely critically important that older adults talk to their families, make sure their families understand what their care needs and desires are, and make sure that everybody's on the same page. They say that's good advice at any time, but it's especially good advice in this time of COVID. A few of us have faced anything like COVID in our lives. There may be a few people out there who remember the 1918 flu pandemic, but not very many. So this is something new to us, something this dramatic, this extreme. But I just want to leave you with the idea that we'll get through this. It's not going to be easy. We can do it, especially if we plan and especially if we communicate with our loved ones. So thanks very much, and I'll be happy to answer any questions in a few minutes.
Howard, thank you. That was one of those sets of remarks that I felt was just as much from the heart as it was from the head. Thank you.
Thank you.
I'm now going to introduce our next speaker. Tom West has dedicated 26 years to advising families struggling with how to support a loved one diagnosed with a chronic illness, disability, or dementia. He is a partner at SEIA, Signature Estate and Investment Advisors, an investment, management, and financial planning firm. As part of his focus on older adults, Tom launched the Life Care Affordability Plan in 2018. It is a fixed fee financial planning and asset management solution to help navigate changing healthcare needs. Quite timely. Tom has been a tireless volunteer leader for many nonprofit and local government organizations with a focus on helping people age well. He is currently the vice chair of the Board of Trustees of Goodwin House Incorporated and previously served in leadership positions on the boards of Insight Memory Care Center and the National Capital Chapter of the Alzheimer's Association. He is a sought-after speaker and commentator for Barron's, Investment News, and the Wall Street Journal. Welcome, Tom.
Thanks, Lindsay, and thank you for the introduction. You always make me feel great about myself with all those kind words. Good morning, everybody. My job in my comments when I'm starting out is to bridge some of the concepts that Howard was talking about what's going on in the broader environment, and bring it down to more of a household level about how seniors actually need to be making decisions through all of the uncertainty, not just with the ambiguity about how long I might live or what kind of help I might need, but also with the overlay of COVID-19 on top of everything. So I really only have one slide that I want to focus on, and this slide is one of my go-tos. I can spend a half an hour on it, or just for today, just give you an idea of, let's appreciate for a second as a group what really the challenges are in decision-making right now in summer of 2020 with everything that's going on. What we're looking at right now is a representation of some of the different challenges about how seniors actually have to make decisions right now with everything going on. And on that upper arc, this is a lot of the world that I think Goodwin House at Home, what we live in. I'm a trustee on the board of Goodwin House. These are a lot of the things that we're talking about and are directly impacted by what Howard was talking about the broader environment. And this has a little bit to do when the senior's looking at it as, who is it that's going to be able to make decisions for me now and down the road? Am I planning for assistance that I might need right now? Or am I independent right now and I'm planning ahead for some assistance that I might need sometime in the future? If I have any health conditions, what health conditions might those be? Am I looking at something where I'm concerned about dementia or a mobility challenge, and how might that impact the planning that I have about where is it that is most appropriate for me? And then the idea of, am I staying in the DC area? Am I staying in my home? Am I moving in with children? All of those different location issues. The world that I live on the bottom has more to, professionally speaking, has a lot more to do with household level decision making and personal finance. And we've got a lot of good approaches I think we'll take in the question and answer dealing with some of these things. But the piece there with the arrows and the different family members, who is it in the family that can assist the senior in terms of making decisions now and down the road? And are those people fully literate? Are they capable? Are they willing to be able to make decisions that might happen sometime in the future? My little icon there with a bucket of money, I always like as a financial advisor to try to zero in on what's really the job responsibility of our money, of our income, of our assets. And what I'm speaking specifically of is, what's the cost of living that we're thinking of now and down the road? What's the cost of care? What's the cost of housing and so on? And are you in control of that? Is that something that you have the ability to influence or not? That's something that's going to impact the plans and the decisions that you make. My icon with the dollar sign in the house, certainly what I'm doing on almost a daily basis in my practice is talking to people about the uncertainty in the financial markets. And a lot of what's going on with COVID, and when you're answering questions about what's going on with the market, well, it's sort of a cart and a horse question. Tell me about how the virus is going to be contained. Then we can start talking about what's going to happen with the economy. Then we can start talking about what's happening with the market. And my challenge for this presentation is giving some guidance about how we as a group make decisions with so much ambiguity. And I always like to think in this way: what are seniors supposed to do? How are they supposed to make decisions? And the main area that I want to talk about is focus first on organizing all of the information that you might need that could assist in making decisions. Organize first. And this process that I'm going to go through is true of many different professional disciplines. Organize all your information first about your finances, about your living arrangements now and down the road, all of your different options, and then try to, step number 2, identify all the different choices that you might make. You don't have to make a decision yet. Identify all of your different choices. Then when I think it's time to make a choice and a decision, try to be real specific about articulating why is it that that is my choice versus some of the other options you're considering. And certainly any good decision-making process has to have a function of being able to monitor and to go back to reevaluate based on new information and new priorities that might come up. The reason I mentioned those 4 pieces: organize all your information, understand what your different choices are, make a choice and be able to monitor, that's the function of a good plan. That's also the function of the best way, I think, to communicate with your family. And I'll give you a short story for the close of my comments. I am a true believer in, and I'm a planner, but I'm a true believer in writing things down. And writing things down, I think, crystallizes the mind and sometimes can be the catalyst for really productive conversations in households. So I'll tell you a story. About 3 years ago, I was sitting with a client in the office, and he'd been a client for a while. We had a very good rapport back and forth. And I was talking about, listen, sir, there's a need to write down what it is that you want and how you're going to be doing things and who's making decisions. And my client was a bit of a smart aleck. So he took pen to paper and he wrote stuff down, and he literally wrote this. He wrote this, and he even wrote the smiley face with the tongue sticking out. So my response as a professional, a seasoned professional, is to remind my client that, well, in fact, you have written that down, and that isn't a very robust plan, but it is in fact a plan. So as we were going through the meeting, I was joking with him and he made me laugh. I took a picture of it. And when a few months went by and we had to get the rest of the family together to make some decisions about powers of attorney and whatnot, I had an opportunity to bring that particular photo out. And there was an adult son and an adult daughter in the room. And when I brought the photo out, it's like, do you want to, let's talk about your plan. And the kids had never seen that before. So step number 1, I always tell people, if your plan is to move in with children, be sure to tell your children that's your plan. But more to the point, the reason that I think writing things down is really important is sort of illustrated in the rest of the vignette. The conversation in the room with the client, it changed significantly. The family got sentimental. They changed the way that they were communicating about what dad's needs were at that particular point, how they might change, how his goals might change. And interestingly enough, even the approach that was a little smart alecky of writing that piece down, that actually was the catalyst to focus the mind of the rest of the family to figure out some of the issues that I have here on this slide. So my point, at least in my prepared comments, organize all your information first. Thank you very much for listening to this program, because this is part of educating yourself. Understand what your choices really are. Whenever you make one of those choices, do in fact make a choice and articulate the reason why that is aligned with your priorities, and then always have a function to come back and monitor, and all of those things, write them down in a way that they can be described to other people. I'll be happy to go into more detail on finances and the market and so on in the question and answer session, but I wanted to leave you with that for my prepared comments.
So Tom, equally from the head and powerfully from the heart. I would imagine that there are probably a few people in the audience that maybe took a swallow with the story, thinking, gosh, maybe that is my situation and maybe that is my plan. So thank you. Thank you both. You have given us a lot to think about and a lot to chew on in this poolside chat. We're going to call it the poolside chat. Now, it's very tempting to get into specific recommendations. Financial markets have been up and down, and We have a lot of questions of people saying, well, what about this type of investment? What about that type of investment? But neither of you stressed that. What you really stressed was planning and communications. Why?
Well, I'll start, first of all, because I don't know anything about finances, so I'd leave that to Tom. But the other reason is that those kinds of decisions are decisions that are driven in large part by what's going on in the market, what's happening in the world. As Tom said, what's happening with COVID. The things that I'm talking about are decisions that you can make that may not be specific about a specific investment to make, a specific place to put your money, a specific place to move, but they're decisions about, in general, what do I want to do? You know, I may not decide when I have my first conversations with my kids that I want to move to Goodwin House, but I may decide in those early conversations that I realize I can't stay at home anymore. So I think the first step, and Tom alluded to this, the first step is to just begin the process. Begin to understand where you are and how your life is changing. And then start working at a very high level, and then eventually work your way down to the very specific decisions, which are going to be very individual to you. We have 120 people on this call. You know, there's no way, even if I knew anything about finance, I could give advice that applied appropriately to all 120 people. But I can say to everybody, start to think broadly about whether your living situation is still appropriate for you, and maybe a couple of years is going to be appropriate for you. And if it isn't, what do I start thinking about doing as an alternative?
Yeah, thank you. I think for me, the way that I answered the question about how come you can't answer specifics, you know, for the audience, I'd imagine that instead of me, the finance guy, you've got a physician on the phone. And the question is, listen, what prescription is right for me? That sort of skips a handful of different diagnostic tests and, you know, making sure that the advice is personalized. When Howard is talking about, we got 100 or some on people on the call, everybody's different. I would start with saying, well, what is it that's specific about you? Are you a solo ager in great health, but you have to come up with a handful of different what if plans? Or are you a very tight, cohesive family unit, but somebody's on the front end of mild cognitive impairment and somebody else might have mobility issues, but all of my kids live locally? We might be in very different financial situations. People might have pensions, people might not have pensions. So the idea of how do you prescribe, it suggests, well, what's our starting point? So I would always preface, Lindsay, any of those things with, what is it that's unique about you in your situation and in your priorities? Because that's effectively what you can work with an advisor to determine what the diagnosis is. That makes the prescription a lot more accurate. We certainly can talk today about some of the broader trends that are certainly going to impact that which is prescribed, but that's probably a good framework to at least start thinking about it. And I, you know, what Howard and I really came into this presentation with is, how can this program that we're doing improve people's ability to make functional decisions as a takeaway, you know, wherever it is that they're starting from? And if we're able to do that, and again, you got my writing down my tip, I think that we're going to be doing a good job in terms of outcomes for the time we're spending together.
So that's probably a skill that, or a muscle and a behavior that most people don't think about when they approach this discussion. They're most likely focused on a question that I am going to ask you because we've received it in spades, and that is, we have financial market upheaval, we have governments that are spending much more than they had anticipated, deficits that are going to cause budget realities for government funded programs. So what advice do you have for older adults as they look in that financial future dashboard and say, I may be facing different scenarios because of these external factors that are impacting my own financial situation and also impacting what it's going to cost me and the access to obtain healthcare?
Yeah, so I think it's very difficult to try to predict the political future. If in 2015 I had told you that Donald Trump was going to be president, you probably would have told me I was crazy. So, you know, I think you can tie yourself up in knots trying to predict what things are going to be like. As you mentioned at the beginning of the event, when I'm not doing aging policy, I'm doing tax policy. So one of the questions we chew over all the time is, what's going to happen to tax rates in 5 years or 10 years? And the answer is, I don't know. You know, if I had to bet, I would say they're probably going to go up, but I don't know that for sure. So you do what you can control. You assume that you are going to have to take care of yourself. The government programs will not be available to you unless you're very, very poor and you're on Medicaid, which is probably not appropriate for most of the people on this call. So you say, how can I make plans so that I will be able to care for myself? Those resources will be there when I need them, and that I can live in the place that I think is most appropriate. Secondarily, you can think about things like bequests and all that. But the first thing you need to be thinking about is, how can I take care of myself? And that's what you have control over. You don't have control over what tax rates are going to be in 5 years. You can control the decisions that you make now that affect your own financial security and your own appropriate housing.
Yeah, I think the way that I treat that question, sometimes some of the people on the call have real functioning relationships with good financial advisors. Some people are doing it on their own. For those that have a good relationship with a financial advisor, it helps to know how we hear that question. We hear that question, and what we want to do is we want to say, listen, we're in the business of probabilities. We're not in the business of certainty. Like I can't predict everything, just like Howard said, for all the reasons, but I can say, listen, you know, the Fed, with the amount of support that they're giving the economy right now, that suggests that there's a pretty high probability that interest rates are going to be low for a long period of time. If you use a point of reference from the bailout of 2008, 2009, interest rates are bouncing around the floor for about 6 years, just if you want a point of reference. I'm not predicting anything. I'm just saying that's, you know, probabilities. You want to at least test whatever your plan is against that. So Howard's right. You know, one of the things that we had going through the Trump administration with the tax cuts, and now we've got a whole bunch of extra spending coming on. You know, I take the approach of things that can't go on forever don't. And sooner or later, the government's going to have to pay for all this stuff. We haven't even gotten to the chapter in US history yet where there's a measure of the fallout of the state and the local government fallout from COVID, where the money's going to have to come from somewhere. And whether it's a federal bailout or increase in state and local taxes, I'm with Howard, I don't know. But I think that we need to brace ourselves as planners to anticipate a different tax regime through the next decade or two.
The other thing I think it's important to keep in mind is that there's always a tendency for people to make these historic comparisons. So, you know, this recession is like that recession back in '06 or something like that.
Right.
You can't do that with COVID.
Nope.
There is no analog to COVID. This is not like the 2008, 2009 Great Recession. It's not like the dot bomb. It's not like the Great Depression. It's a sui generis, completely unique event.
Yeah.
And trying to predict what it's going to be like coming out of this is just a fool's errand. We have no idea.
I agree.
So one of the benefits of this poolside chat is not simply questions that we've thought about, but questions that you have of each other, and allowing us to hear how two great thinkers, one seeing it from a policy perspective, one seeing it from a financial planning perspective, what curiosities you have about your own perspectives.
So Tom, I'm curious, what do you do? I joke around sometimes and say, when I talk to consumer groups, one of the questions I get, or one of the responses I get all the time, I ask people, what have they done to plan? And they say, oh, my plan is just shoot me. So Tom, I suspect you get that too. How does somebody who comes in with a mindset that I don't even want to think about this, I don't want to think about old age, I don't want to think about long-term care, I mean, how do you get them even started down what has to be a very uncomfortable path?
Well, the best way, that's an interesting question. And, you know, I will look back on my history at Goodwin House. So this has really influenced my answer. So Lindsay's predecessor in marketing and strategy remains a great friend of mine, Colleen Ryan Mallon, and she told me that there's a way that senior living organizations can look at this different population, and that helped me develop the answer to that question. And that is, and this is sober, of the people that are going to be retiring, they can fall into 3 different categories. There are the planners, which everybody likes working with. These are the folks that know exactly how much money they have, what their health situation is. They've already had the conversation with the kids, and everything is about fine tuning and making sure that everything's optimized and working with efficiency. Everybody loves those clients. That's like a third of the population max. The other end of the spectrum are the crashers. These are people that I mean, we're seeing this on the news cycle. Personal responsibility really isn't my thing. I'm not going to be paying attention to a lot of problems, and my plan is somebody's going to come to rescue me. That's my plan, right? And what I've learned as a professional, and interestingly, this is irrespective of wealth or education. Like I find those things not correlated to this particular attitude that you're asking me about. They're folks that are just going to crash into the system, and the system has to figure out how to help them or not. Those are the ones that are a very different kind of risk. Then there's the middle, which I think is the most interesting one, and we call them procrastinators. I'm sensitive to all these things. I've touched on some of them, but I don't know exactly where to begin. And I think that that's the population inside of your question that really is interesting to me, because the planners are going to be seeking out the right answer because that's how they're programmed. It's that middle group. What can we as planners, or if I'm wearing my board member hat, what can we as representatives of a great organization like Goodwin House, what can we do to enable, to empower those people to have better agency over that sets of decisions? And a lot of it has to do with education and being able to make sure that they know they can ask for help in a safe way. And sometimes wisdom is just knowing who to call. That's part of what we try to do with that population in the middle. That's a good question. I got a question for you. Howard, for the last 20 years, you and I have been talking about immigration and the impact on the long-term care service industry. And for the audience, one of the things that for you to remember is, you know, a significant number of the workforce that does the heavy lifting in senior housing and healthcare and home care and so on aren't born in this country. One of the things when we're talking in this forum about what are the projections of the cost of care in the future, if we think about a supply-demand issue, if we think about we've got a lot of seniors getting older all at the same time, and we look at the current situation where, let's say, immigration isn't, let's use the word functional right now. Howard, play this out for me. What are the different kinds of pressures that our audience needs to anticipate as it relates to the availability of a workforce where there's expectation that there's always going to be somebody around to help me? We've talked a lot about that being a challenge. Could you comment a little bit on that for me now and in the future?
Sure. So this is a really important question. And just for a bit of context, let me talk to you about family caregivers first, and then we can talk about paid aides. So in 2010, 10 years ago, when people first looked at this, they looked at the number of available caregivers there were, people of caregiving age, say from 40 to 60, and the percentage of them relative to the number of people who need care, people over 80. And in 2010, there were about 7 people of caregiving age for every person who needed care. By 2050, there will be 3. So the number, and that obviously because baby boomers had very few children, and that's the demographic consequences. Now that's baked in the cake. There's nothing we can do about that. I'm not going to have any kids at this point in my life. So if there are fewer family members to provide supports and services to their loved ones, we get to Tom's question, that means that we're going to have to pay people to do it. We already, even before COVID, were beginning to face a significant shortage of aides because the economy was strong, because the work, as I was suggesting before, that aides do is very difficult because the pay is very low. It was getting to be a point where it was very challenging to find aides. Now, in some ways, it's even more challenging. So yes, the economy is bad and there's lots of people unemployed, but most of those people are not trained and they don't really have the the kind of internal fortitude it needs to do this kind of work. So the number of aids that are available is still relatively small, and the demand for aids is getting greater. COVID has made this work even more risky, so people are going to be even less likely to do it. And it's also going to require facilities, particularly, to use more aids. They're going to need more people to do better infection control. You're probably going to eliminate, a lot of nursing homes have double rooms and quads. They're probably going to have to eliminate those. That's going to require more aids. So we're going to need more people just at the time when fewer people want to do the work. And then to get to Tom's question, actually about a third of the on-the-books aids are immigrants. Of course, there are many aids in the gray market, the ones that you find little 3x5 cards up in the supermarket. We don't even know much about them. But of the ones that are licensed, that are on the books, that the Labor Department knows about a third of them are immigrants. And not to get political about it, but the Trump administration has made it very difficult for immigrants, particularly those in low-wage jobs, to come here and work. So all of that means, when you add it all up, it means that we are going to have what was already a severe shortage of aids is going to become a really serious shortage of aids, just at the time when there are fewer family members to take care of us. Bottom line, the cost of that care is going to go up, and probably significantly.
Yeah, and I think as I listened to your answer there, for the audience, what I'm hearing is affordability isn't the only question. Affordability of care also needs to be considered about access to care. The idea of just because I have the money and the plan to be able to afford it doesn't mean that it's easy to find. So I think post-COVID, if you're listening carefully, there's going to be more and more of a premium of knowing in advance that you have access to the caregiving that you have, because it's going to be a very different story in 2025 than it is right now. After COVID shakes out the senior housing and healthcare industry into who knows what the post-COVID universe of that's going to look like, for all of Howard's comments. But if you're listening carefully, I think that knowing that there's a premium on access, I think that's going to be part of the reality on the other side of this.
That's exactly right. That's exactly right. Money is necessary, it's helpful, but it's not sufficient. You need more than that.
So I want to share a Goodwin House reference point exactly on what you just gave us in the way of a history and a future lesson, Howard, on the availability of talent. And I'll put it in the context of an organization, as I said, that serves 2,000 older adults every year. We made a decision in the spring to ask our employees to make the difficult choice of choosing one employer. And Goodwin House said, if you don't choose us, that's okay, because the choice you're making is going to benefit the region and help us all be safer. That's a good thing. But in making that choice, we realized that many of our colleagues would go down to one job when potentially they had 1.5 or 2 jobs. And we were able to supplement that income through the Goodwin House Foundation, the donors, the wonderful, generous donors to the Goodwin House Foundation. And by virtue of our board supporting management's decision to have differential and hero pay. The impact of that financially on Goodwin House and the additional cost of PPA and the additional cost of testing, proactive testing, we anticipate will be $5 million between March and end of September. Goodwin House is fortunate. We have been very conservative and very focused on strong financial health. We are able to weather the storm. Not every senior living organization is going to weather this storm. So when you rerun your numbers in the future, Howard, for how many nursing homes are there are going to be fewer of them because they will not be able to weather the storm. So Tom, you're absolutely right when you say, while we take it for granted today that the care will be accessible, it may not be as accessible and it will likely be more expensive.
And that's exactly right. And after having said making predictions is dangerous, I'll make one. And that is that there's going to be, I think, a dramatic shakeout in the senior care industry. I don't know if it's going to result in the overall number of beds going down very much, but I think a lot of the operators are going to go out of business.
Oh, yeah.
And this is going to be a particular problem, not going to be so much an issue in the DC area, but this is going to be a particular problem in rural areas where there already have been serious shortages of care facilities, of medical care of all kinds, actually. So this is going to be a growing challenge. People are going to have to start thinking about alternatives because the facilities aren't going to be there. It's also true that it's an interesting thing. I find myself in between this world where I talk to some people on the political left whose attitude about nursing homes is turn them into parking lots. None of them should even exist. And then other people who say, and I'm in that group, that say that's the wrong solution. There are inevitably going to be people who have to live in long-term care facilities. They can't take care of themselves at home. They have no family to take care of themselves at home. They have to have a place to go. But we need to rethink what that place looks like in this new world. And it's going to be a real interesting debate over the next few years about who wins. Do we reform this model or do we eliminate this model? I think in the end, it's unlikely that it will be eliminated, but there are people out there who are very aggressive saying we should not have nursing homes in the United States, ever.
Well, let's introduce some of the audience questions about some other aspects of societal support. How concerned should we be about the future of Social Security?
I'll start with that one, and Tom can probably disagree with me. I think for the people that I suspect are on this call, who are probably all over 65, I think you should not be concerned at all about the future of Social Security for yourself. Should you be concerned about the future of Social Security for your children and for your grandchildren? Yeah, you should. It's not going to go down to zero. People will continue to get benefits, but are they going to get the benefits that they've been promised? Probably not.
Right. And I actually agree with you, Howard. I'm not too concerned about the availability of Social Security benefits, but let's remember that the government works in mysterious ways. We haven't talked about taxation on your Social Security. That's something different. Remember, Medicare premiums come out of your Social Security check. Do you think Medicare premiums are going to stay the same, go down, or go up? So I think the idea of what's my net Social Security, that's a different question than what is my Social Security safe. The other piece, remember that the way that you fill out your taxes about Social Security, you've got this thing called threshold income. The concept is the more money you make, the higher the percentage of Social Security that's taxed. I think that you have to assume that taxing Social Security, that's going to have an easy bullseye on it. And the Medicare premium net out things, I do see that as an open conversation as soon as next year. But I agree with you in terms of the Social Security Trust Fund. The fixes are relatively straightforward. Raise the wage base. You can tweak a few other things. It's going to be there. The question is, what's going to net out to seniors? That's going to be, I think, the first threshold to that question, Lindsay.
Yeah, Tom, you're right. I mean, fixing Social Security is easy. The policy solutions, we've known them for 30 years. We just haven't had the political will to do them.
So a topic that's receiving an equal number of questions is around long-term care insurance. Many of our registrants have said that they have experienced sharp increases in the recent past. And do you think that that's going to continue? And then there's a pointed question, which is, should we continue with long-term care insurance, or should we, these were the words on the question, not mine, dump it and go to a life care organization model?
I'll start with the first half of the question. I'll leave Tom to answer the second half. So what's going on with long-term care insurance? The business of standalone long-term care insurance, as opposed to what they call hybrid kinds of models, this is standalone policies, has essentially collapsed. Last year, they sold 60,000 policies in the entire country. The reason it's collapsed, it's a classic story of a market failure. Consumers don't want to buy it because it's too expensive. And insurance companies don't want to sell it because the risk of what they call the tail risk, the risk of those relatively few people who have really long spells of long-term care needs, is too great. So what happened was the actuaries over the last 30 years have consistently underestimated how much claims were going to be And through no fault of their own, they've also overestimated how much income they were going to generate from the policies. Remember, the business model of long-term care insurance policy is they start collecting premiums from you when you're in your late 40s, early 50s. They collect premiums for 30 years, and then they start paying out benefits. The idea was they were going to invest those premiums and use the investment income to pay the benefits. The problem is that most states require them to invest in super safe bonds, and those bonds are paying interest rates of approximately zero. So what's happened to the insurance companies is, on one hand, their income is down. On the other hand, their their claims are up. The only thing they can do is raise premiums. And year after year, I talk to them and they say, we got it under control. We finally figured it out with these legacy plans. We know what the real premium is. And then 3 years later, they raise premiums by another 60%. The other problem they got is the regulators make it really impossible for them to raise rates gradually, a year at a time. So they have to wait 3 or 5 years, and then they hit consumers with a 30 or 50% premium increase. So it's the standalone long-term care insurance industry has got a problem. The other piece of it, the industry that sells hybrid products where you combine a long-term care insurance product with an annuity or a whole life policy, they're doing a little better, but that's a market that's limited to a relatively small number of high net worth people. So Tom, I'll leave you to the rest of it.
Yeah, I think for me, it's the question, Lindsay, smacks a little bit of the diagnosis prescription framework that I talked about earlier. I started my career a million years ago in long-term care insurance, and Howard was an early mentor of mine. That's where we met a zillion years ago, talking about the future of the industry. I think that the premium increases that individuals are looking at, they're going to treat people differently. You know, there are families that are going to have a really hard time eating another $3,000 or $4,000 a year of premium increase that might be coincident with changes in health and needing to consider transitions in terms of where they live. That's an entirely different conversation than a client that I had 2 weeks ago that had a 100% premium increase, and they were fire mad about it. But their premium started at $1,600 a year. That was going to $3,200 a year. And, you know, it wasn't the plan that the premium was going up, but this client had a lot of money. And it was more the principle of the premium increase than it was the financial impact of keeping it going. The best answer truly is every situation is different. I will share with you that I have not recommended dropping a long-term care insurance policy to anybody that I've counseled in the last 3 to 5 years, because all other options are worse than they were a little while ago. That's part of the reality of where we're sitting right now.
Yeah. And some of those old policies are great policies.
Yeah,
they cover
the
lifetime
insurance company
risk.
really wants you to drop them.
Yeah, exactly. So yeah, a lot of them you don't want to get rid of, even if the premiums do go up.
So gentlemen, this has been fascinating, and I loved the back and forth with you two. I loved the heart and the head. You brought your full selves here. I'm going to close with a question and make it somewhat personal. Let's assume that in the audience is someone you love. It could be an aunt and uncle, or an aunt and uncle-like figure, or a parent, or an older sibling. And you want to give them the best of your head and your heart. And you make your closing pitch for planning, communicating, navigating the impact of the pandemic on healthcare affordability and accessibility.
Tom, you want to start?
Sure. And my parents might be on the call, so I think the best way that I would answer the question is, in a universe of ambiguity, I think that the best thing that loved ones or anybody can do, truly it's the same advice, you know, focus on the information that you can control and make decisions about. And I would start with, know exactly where it is that you stand. What does the status quo look like? If you've got to go to the hospital because of a fall, can you be discharged back into your home or not? If the answer is no, where are you going to go? How does that work? Who's going to be making decisions under what circumstance? Where would you go to find the answer to that question? Fully define where you sit right now, because people are starved for prescriptions and answers, but they don't have a full understanding of even diagnosing their personal situation. So to the degree that you can understand, what are my health conditions now or down the road? If something happens, what's actually going to play out? Because that is the plan. The plan is the status quo until changes are made. And if you go to a hospital, for example, whether you have a plan or not, you're still getting discharged. So know exactly how that stuff plays out. That would be my advice to anybody.
So let me just end it with an anecdote. About 10 years ago, I did a book on this called Caring for Our Parents, shameless plug. And I wrote that book. I got interested in this topic and wrote that book because of a personal experience. My in-laws got sick, and then right after that, my own parents got sick. I saw personally the consequences of what happens when people don't plan. My in-laws made no plans. And my mother-in-law was caring for my father-in-law who had cancer, and no one in the family knew it. And my mother-in-law, who took on all the responsibility of being a caregiver, had a stroke. And my wife and I and her brother had to deal with all of this while her mother was lying in a hospital bed on life support. And having seen the consequences of what happens when you don't plan, the only thing I can say is you don't want to be there. What Tom said is exactly right. You need to anticipate what might happen, and you need to plan for it. Too often what I see, and Tom, I see this every day, what I see is somebody has a near miss. Mom has a stroke. She recovers from the stroke. And instead of taking that as a signal that you need to plan, they say, oh, she's fine now, we're done, we don't have to worry about it. And then, of course, 2 years later, she has another stroke, and this time she doesn't recover. So I think it's just critical that you take the time to plan while you can. And as Tom and I keep saying, and then don't just plan and keep it in your own head. Talk to your family about it. Make sure that all the kids are all on the same page. They understand what you want. Because the last thing you need is a situation where you think you've got it all figured out and you had that stroke, and now the kids are all fighting with each other because they didn't know what you wanted. And Jane thinks you wanted one thing and Joe thinks you wanted something else. And Sue from California flies in and has a completely different idea. And you just don't want to be there. You work this out as much as you can. And COVID ought to be a lesson to all of us about what happens when you don't.
At the beginning of this webinar, I said all of this was very personal, certainly for those of us in the Goodwin House family, and obviously very personal and very heartfelt with your own situations and how you have matched your career expertise with your personal experience, and you've been so generous in bringing your perspectives forward to our audience. So I want to thank you both very, very much. I hope this is the first, and there will be other opportunities to hear from both of you. So thank you.
Thanks very much. Great to be with you, and good luck at Goodwin House.
Thank you.
Thank you. As Katie mentioned at the outset of this webinar, we have been recording it, and we will send a link to the recording to all registrants, as well as a written document with the Q&A and the answers completed. In addition to this webinar, to help you stay financially healthy during the pandemic and beyond, Goodwin House has developed many other resources to help older adults stay physically, emotionally, and socially healthy. We gladly make these available at no charge, and you can find those resources on this very page you're seeing. This is our COVID-19 landing page on the Goodwin House website. And when you see this photo, you can scroll down, you'll see 4 tabs right across the center. And you click on any one of those tabs, and particularly the tab that says Staying Active and Engaged. And you click on that, and you will see a lot of the specific webinars that we've done beginning in March, and we'll continue to be hosting webinars. There is more to come. So as we scroll to the next slide, you see we've got some upcoming webinars. One we're featuring on September 17th, a little bit of an August break here in Washington in terms of webinars. However, you'll notice that you can see all of those webinars that we have produced by going to this landing page, and you'll see those webinars listed. It's complimentary, no charge. Click, play, and learn from the various experts that we've featured on these webinars. So, to our listening and viewing audience, thank you for sending your questions and for joining today's programs. As noted, we will send a Q&A, written Q&A with the questions that we were not able to address on the webinar, along with the link to the recording and the PowerPoint slides next week. Please stay safe, study up and plan, and feel welcome to reach out to anyone on the Goodwin House at Home or Light Plan Community sales teams if we can be of support to you. You can reach us at the phone number and the email that's listed on this slide. So let me read the number to you, 703-578-7201, or email us at info@goodwinhouse.org. Thank you very much. This concludes today's webinar.